Hello, my dear ones. I'm recording this answer especially for you to address probably the most common question. Sex and sexual problems in Peyronie's disease is the most relevant topic, and it's one that patients often completely misunderstand. So please listen carefully until the end. What? How? Where? I'll try to be detailed for you and explain everything in detail. So at the first stage, sex with Peyronie's disease is also divided depending on the stage. Yes, we will consider this according to the stage. At the first stage, when there is only pain in the shaft of the penis, as a rule, many people still don't understand what kind of trouble has happened to them. And patients treat it simply as pain, and only the pain stops you. But attention, pain is just a marker. In reality, there is inflammation going on inside, which as it progresses leads to this change, to this plaque. So based on this, is it possible to maintain a sex life with Peyronie's disease? Not only is it possible, but it's actually necessary. Do you know why? Because Peyronie's disease, as I've already told you, never occurs as a single pathology. It is always a complex disease that includes several other conditions. And I'll talk about this in more detail in other videos. So for other conditions, abstinence can actually be very harmful. That's why you should try to have ejaculation twice a week. But what if there are some particularities? Yes, there are nuances. You shouldn't have a very active sex life, meaning you shouldn't disturb, disrupt, or irritate the plaque, as this can cause even more serious inflammation. Imagine that there's a small wound there, and by making vigorous movements with the penis, you're essentially aggravating that wound, which increases the inflammation. You shouldn't do this because it will worsen your condition and increase the inflammation. Is that clear? To sum up once again, sex is allowed and even recommended, but it should be gentle without rough thrusting. Next, the second issue that patients with Peyronie's disease often face is a decrease in potency. So Peyronie's disease itself very rarely causes erectile dysfunction, only if some nerve is being pinched, which is quite uncommon. In my practice, I have rarely seen this. But what have I seen often? What I have often seen is psycho-emotional tension in patients. He looks and sees that something is wrong, something hurts. And he thinks, oh, maybe I have inflammation there, maybe something is wrong, maybe even my potency will change. Has it already changed? Oh yes, now it's already gotten worse. And now it's even worse. And now it's really bad. This is called psychogenic impotence. So guys, you often wind yourselves up to the breaking point all on your own. So there's no need to invent any other pathologies related to Peyronie's disease, complementary or associated with it. Yes, erectile dysfunction can occur due to Peyronie's disease itself, but in principle, it is extremely rare. That's clear, right? The subsequent condition is intimately related to one's sexual life, specifically concerning Peyronie's disease. I will endeavor to explain this intricate psychogenic component to you in much greater detail, providing a comprehensive understanding. After all, how are we used to living in this world? We're used to, for example, if our nose is a bit crooked, we get used to that crookedness. If a finger is a bit crooked, we get used to that crookedness and consider it normal. But if you had a straight finger before and it becomes as crooked as what might be normal for someone else, even for the majority, for you it will still feel crooked, foreign, and unpleasant. And it's precisely this aspect, this way of looking at your own organ that has changed shape as something foreign, crooked, strange, unpleasant, provoking a sense of protest, like, how could this happen to me? What's going on? This is what creates a vicious cycle. And from this state, from these thoughts, your illness gets worse. And as your illness worsens, your overall condition deteriorates as well. And the combination of depression and, as a result, erectile dysfunction, along with Peyronie's disease, is a very common occurrence. It's like when you start obsessing, well, you can get worked up over anything, like not having enough money. And it's the same with depression. The less money you have, the more depressed you get. That's why most people know how to say, okay, we'll figure it out, and actually deal with the problem. You will only be able to deal with this problem by seeing a doctor. I can tell you about folk remedies, but they will only provide some short-term relief. It's extremely rare for my patients to actually cure themselves with folk remedies. I vividly remember one patient who really did cure himself. He came to see me at the final stage just to get evaluated, checked, and for prevention of the disease itself. Not the plaques, but the disease itself, because the disease is not the plaque. The disease is the tendency to form plaques. So it's unlikely that you'll be able to cure this tendency to form plaques. You might still try to do something about the plaque itself and think about it. I'll record a separate video about this. Moving on. You know what the most interesting part of sex life is? This is already the sex life stage, when the plaque has almost fully formed, when the penis is curved. And very often men worry, you, my dear ones, worry, about whether your partner will find it interesting to be with you with such a curved penis. Here's an interesting point. If your partner is a long-term one, strangely enough in my practice, I often see women who are actually interested. I very often talk with wives. Almost always, if a patient comes with his wife, I always examine him in the office with his wife present and gladly discuss with her any questions that are appropriate to discuss with a spouse. Because the wife is actually the doctor's best friend. She keeps an eye on things, she is an interested party, and she will help the man participate. And accordingly, help me as well. That's why we often talk specifically about sexual problems, to reduce the level of tension on this topic within the couple and to clarify any unclear issues. Because, well, achieving a normal and fulfilling life for the patient, including a healthy and satisfying sex life, is absolutely the key to ensuring your future overall health and well-being. So, gentlemen, it's important to understand that wives are actually quite interested in and often appreciate a slight gentle curvature of the penis. This is because their sensations experienced during sexual intercourse can become significantly more vivid, more intense, and indeed more unusually pleasurable. Moreover, you can try different positions during sex and find those spots where it's especially interesting to press with this curvature and then apply pressure to them during thrusting. So in this case, it might even be a more advantageous situation than not having Peyronie's disease at all. That's when the curvature is minor. But when the curvature is severe, thrusting becomes impossible. That's exactly the kind of problem that requires surgery. If Peyronie's disease has been going on for a long time and the curvature is severe and thrusting is impossible, it's impossible to have a sex life. The penis slips out of the vagina. If you get distracted for a moment, that's it, it's out. So there's no sex life at all, it's just not interesting. Well, oral sex is an option, go ahead and practice that. But I don't think you'd be willing to rely on oral sex for your whole life. If you're okay with that, you don't have to operate on Peyronie's disease, specifically the plaque. Peyronie's disease itself is treated separately, and the plaque is treated separately. Once again, if intercourse is impossible and that doesn't suit you, the only treatment is surgery. If the disease unfortunately lasts for more than 2 full years, and if a detailed ultrasound examination clearly shows a hard, dense and persistent plaque, then there's absolutely nothing further we can effectively do to remove it. You can try though. In 30% of cases it works, but in 70% of cases it doesn't. Surgical treatment means either removing the plaque itself or using implants. I'll talk about this in other videos. There are already some on YouTube where I've discussed it, and I'll give you more details in my paid guides later.